Our planet, Earth, the best place for origin of life, and after that for its survival, was not like this before. It takes millions of years to originate and evolve life. Origin and evolution of life are not interconnected. However, they are closely related to each other. For more than millions of years, Earth has cherished life, and now we can discover life in a very small forms to large forms. We can see the existence of large variety of life forms on Earth. Among numerous life forms, humans evolved significantly with time. In the way of our evolution, we have done lot of struggle, hardships, and gone through tough times. We fight for our existence and have seen many crises and disasters. We have enjoyed many brave moments and also experienced the moment of fear. We have acquired knowledge source and developed skills to fight and win against visible and invisible dangers. We learn to fight for our survival. Sometimes we learn to hide and waited for the right time with patience. And on certain occasion, we ran far from the danger to save our precious life. It's easy to confront the visible danger, but it's hard to protect ourselves from invisible danger or enemies. These invisible or unseen enemies are those microorganisms or factors which are responsible for causing diseases. In past, because of these microorganisms, we have faced many fatal diseases. And lost many of our friends and family members. But despite not knowing much about that unseen enemy at that time, we somehow able to save our civilization. We have seen bad times and good times in the past, and that's why we are able to evolve and to develop technologies based on our experiences and needs. Now, with the advancement of science and technology, today we know that the fatal diseases which we faced in past were mainly because of bacteria and viruses. Bacteria are single-celled living forms, while viruses are not considered to be living, but are submicroscopic infectious agents that need living host for replication. These viruses are found in almost every ecosystem on Earth. And they can infect any form of life. like all the other organisms, human race is also vulnerable to get infected by viruses. Few viruses are fatal for humans and are potential in spreading catastrophic epidemics through their pathogenicity. In December 2019, another form of virus knocked our doors, and we were not fully aware of that intruder. The world came to know about the virus very late, when the situation becomes serious, and World Health Organization has to announce it as a pandemic situation. The wet market of Wuhan in China was the epicenter for the outbreak of this virus, which was later named as novel coronavirus or COVID-19. It was assumed that pangolins may be the missing link for transmission of this novel coronavirus from bats to humans. Coronavirus caused disease in mammals and birds. In humans, the virus caused respiratory infection, including common cold, which can be lethal like Middle East respiratory syndrome and typically mild like severe acute respiratory syndrome, including COVID-19. Now let's take a closer view on COVID-19 virus and how it spreads. COVID-19 belongs to family of Coronaviridae and genera Beta coronavirus. Its structure is roughly spherical with bulbous surface projections. It consists of positive sense single-stranded RNA genome which ranges from 26.4 to 31.7 kilobases. COVID-19 has affected around 213 countries and territories around the world. Presently, more than 6 million of world population is infected by COVID-19 and more than 3 million people died because of it. COVID-19 is a fast spreader and can spread mainly by respiratory droplets of infected person to healthy person during sneezing, coughing, and even speaking. The respiratory droplets do not travel far in the air as they are heavy and settle down quickly. The droplets can land on any surface or on any object, for example, table, doorknobs, handrails, cardboard items, paper, plastic items, cloth, etc., and can survive there up to many hours or even days. But we can easily clean these surfaces by using common household disinfectants or detergents. The symptoms of disease are very similar to those of common cold or pneumonia, and therefore could not be diagnosed in its initial stages. The symptoms can appear anywhere between 2 to 14 days after exposure, and the common symptoms include fever and chill, dry cough, shortness and difficulty in breathing, fatigue, muscle and body ache, headache, loss of taste and smell, sore throat, congestion and running nose, nausea, and diarrhea. The risk rate of developing serious illness is relatively higher in children and older people, and those with medical problems like high blood pressure, heart and lung diseases, diabetes, cancer, and other chronic diseases. Basic steps and practices which can protect us and our family from infection of COVID-19 include washing hands often and thoroughly with soap. If soap and water are not available, use alcohol-based sanitizer. Avoid close contact with people who are sick or have contact history with COVID patients. Avoid touching your eyes, nose, and mouth. Cover your face while coughing and sneezing. Cleaning and disinfecting frequently touched objects and surfaces will also be helpful. Thoroughly wash vegetables and fruits by clean water. Self-isolate or quarantine yourself when you feel sick. Important to stay at least 2 meters away from other people. Wear mask at work or out in public. It's important to seek immediate medical help when you develop symptoms, especially when you live in an area where malaria and dengue are common. Shockingly, it is reported that pets like dogs, cats, and ferrets are found to be corona positive as they are in close contact with infected person. But yet, there is no report of transmission of COVID infection from infected pets to the humans. With time, COVID-19 infection and cases are rising sharply, and therefore every country is making strategies and implementing important measures to combat the growth of infection. These measures can vary country to country depending on the number of cases, spread history, and other relative factors. But there are some common measures adopted by every country, and these includes full lockdown, no public gathering, social distancing, mass testing of COVID-19, restriction in international traveling, implementing health measures. Presently, there is no vaccine for COVID-19. Researchers all around the world are working rapidly and smartly to find a solution by means of modern and traditional medicinal system. Meanwhile, different drug combinations are in use to treat COVID patients. These drugs do not kill the virus, but they boost the immunity and increase the possibility of our survival. However, World Health Organization do not promote and recommend self-medication with any medicine against COVID-19. The drug combination presently in use to treat COVID-19 includes lopinavir and ritonavir HIV drug combination, chloroquine and hydroxychloroquine combination, remdesivir HIV drug with combination of swine flu drug and malarial drug is in use. Different countries are treating COVID-19 patients by different drug combination depending on the positive results and availability of drug. But still, it's a long way to find an accurate and efficient combination, and it's too early to depict the side effects of these drug combinations. Vaccinations are an important part of public health, which prevents the spread of contagious, dangerous, and deadly diseases. Actually, vaccine activates our immune system without causing any side effects. But vaccine would normally take years to develop. However, researchers from worldwide are speeding up the efforts to produce an efficient vaccine against COVID-19. The world is working together to find a way and to fight against this virus. All the developed and developing countries are working actively to develop an effective vaccine in a short period of time. In this race of vaccine development, some scientific groups are getting positive results. While some experimental vaccines do not show much effective results and are still in a way of finding the appropriate outcome. The good news is that there are more than 110 prospective projects working in finding cure for COVID-19. Among them, some vaccines are in phase 1 trial and some in phase 2 trial. Hopefully, we will soon develop the vaccine. The developing of vaccine will surely take time, but meanwhile the more important concern should be that what can we do to remain safe? To achieve victory against this virus, we have to follow all the self-protection and self-hygiene measurements, along with social distancing. Corona pandemic has changed our lives socially and economically. This time, it's an alarming call which shows where we are lacking and where we have to fill the gaps. From past, we developed a lot and have advanced technologies, but even that, we are still struggling to win the fight against many diseases, disorders, and sudden outbreaks. As many puzzles of life have yet to be solved, and this path seems to be full of hurdles. We have to build a healthy lifestyle to boost our immunity. There is a lot to do in medical and health sector. The path is definitely very long and difficult. But for victory, we have to move forward. In harmony with nature, science and technology, we will soon able to solve the mysteries of happy and healthy life.